Hello and welcome to my case study of INOVA Fairfax Hospital. My name is Sarah Scannell and this presentation is in part of a HAP 725 class at George Mason University. So to begin, all the data for this analysis was sourced from a CMS Hospital Compare data. The specific files and the link to the data are all listed on this slide. So INOVA Fairfax Hospital has 4 competitors in the area: INOVA Alexandria Hospital, INOVA Loudoun Hospital, INOVA Farrokh Hospital, and INOVA Mount Vernon Hospital. The quality indicators I analyzed were specifically for cardiac care. Both acute myocardial infarction, or AMI, and heart failure, HF, were analyzed for mortality and readmission rate. Mortality rate estimates a hospital-level 30-day risk standardized mortality rate for patients discharged from the hospital with a principal diagnosis of either AMI or HF. Mortality is defined as death from any cause within 30 days after the index admission date. Readmission rate estimates a hospital-level 30-day risk standardized readmission rate for patients discharged from the hospital with a principal diagnosis of either AMI or HF. The outcome for this measure is defined as unplanned readmission for any cause within 30 days of the discharge date for the index admission. Timeliness of ECG is defined as the median time from the emergency department arrival to ECG performed in the emergency department prior to transfer for AMI or chest pain patients with probable cardiac chest pains. Guidelines recommend that ECGs be performed within 10 minutes of arrival. The first limitation of the data is that all the hospitals are owned by the same company, INOVA. The second limitation is that the current data is unavailable for some of the quality indicators. And lastly, this data uses multiple hospitals that are of different size and different amounts of patients. So in this first chart, we're going to discuss the median time to ECG. So on the x-axis is the midpoint of the reporting periods available. On the y-axis is the median time to ECG. Control limits are shown in red and are calculated using the competing hospitals' values. So as you can see here, during the 6th, 7th, and 8th reporting periods, INOVA Fairfax Hospital had a lower median time to ECG than its competitors, and this means that it is outperforming its competitors. The second one is going to be INOVA Fairfax Hospital on acute myocardial infarction, or AMI, the 30-day mortality rate. So again, x-axis is going to be the midpoint of the reporting periods, and y-axis is going to be our mortality rate for AMI. Control limits are shown in red and calculated using the competing hospitals' values. During the second reported period, INOVA Fairfax Hospital had a higher mortality rate for AMI than its competitors, and during the second to last and third to last reporting periods, had a lower AMI mortality rate than its competitors. Alright, so this next one is INOVA Fairfax Hospital on acute myocardial infarction, or AMI, 30-day readmission rate. Again, the x-axis is showing the midpoint of the reporting periods available, and on the y-axis is our readmission rate for AMI. Control limits are shown in red and also calculated using the competitor hospital's values. During the first reporting period, INOVA Fairfax Hospital had a higher rate of AMI readmissions than its competitors, but by the last reporting period, we can see a downward trend, and they were had a lower AMI readmission rate than their competitors. Alright, and this one is INOVA Fairfax Hospital on heart failure 30-day mortality rate. So on the x-axis again is the mid-reporting period. On y-axis is going to be our mortality rate for heart failure. Control limits again are shown in red and calculated using the competing hospitals' values. So during our 6th reporting period, INOVA Fairfax Hospital had a higher heart failure mortality rate than its competitors, but by the last 2 reporting periods had a lower heart failure mortality rate than its competitors. On the x-axis, again for this one, and this is the INOVA for heart failure 30-day readmission rate. X-axis again is the reporting periods, and on the y-axis is our heart failure readmission rate. So for this one, during the first 2 reporting periods, INOVA Fairfax Hospital had a higher rate of heart failure readmissions than the competitors, and by the last 3 available reporting periods, INOVA Fairfax Hospital had a lower heart failure readmission rate than its competitors. So to summarize the findings, INOVA Fairfax Hospital did better than its competitors in median time to ECG. And where they had points both above and below our control limits, they did both better and worse than the competitors in heart failure readmission rate, heart failure mortality rate, acute myocardial infarction and readmission rate, and acute myocardial infarction mortality rate. Thank you so much for watching my case study video, and if you have any questions, please leave it below in the comments. Thank you.